The moment a neonate is delivered, it undergoes a violent physiological shock. It must instantly abandon placental oxygenation and force its lungs to expand and pull in air. If this transition fails, the lack of oxygen destroys brain tissue rapidly. Clinicians have exactly 60 seconds to evaluate viability. By the critical 1-minute mark, the medical team needs a definitive, absolute answer on whether the infant is surviving. Before the 1950s, obtaining that answer relied heavily on a doctor's subjective intuition. One physician might view a quiet baby as peaceful, while another recognized the silence as severe hypoxia. In crowded postpartum wards managing dozens of deliveries simultaneously, this lack of standardized measurement resulted in missed distress signals and fatally delayed interventions. To eliminate this guesswork, Dr. Virginia APGAR designed a rigid 10-point quantitative assessment tool. Dr. APGAR, an anesthesiologist, needed a method that was entirely objective and completely immune to the panic of a crashing newborn. Her resulting system replaced subjective observation with an actionable algorithm, standardizing neonatal care across the globe. To work during a high-stress delivery, the assessment tool required a structure that any nurse, midwife, or attending physician could recall instantly. The system isolates the newborn's overall condition into 5 observable physiological pillars. Each pillar is evaluated and assigned a strict integer value, 0, 1, or 2. This visual matrix organizes the criteria. We have 5 rows matching the letters APGAR on the y-axis, and our 3 potential scores on the x-axis. A 0 represents severe depression or a total absence of biological function, while a 2 indicates vigorous, normal activity. We are going to build this matrix from first principles, converting a simple acronym into a clinical reflex. Memorizing these exact parameters dictates whether a clinician hesitates or initiates life-saving resuscitation. The first metric is A for appearance. This serves as a rapid visual proxy for systemic oxygenation and cardiovascular perfusion. Looking at the top row of the matrix for appearance, we evaluate the skin color. A score of 0 is assigned for central cyanosis. Central cyanosis is a condition where the core of the body and the mucous membranes are completely blue, indicating profound oxygen deprivation. If the infant presents this way, they earn 0 points. A score of 1 is given for acrocyanosis. Acrocyanosis means the infant's main torso remains pink, but their extremities, like the hands and feet, have a blue tint. This partial coloration earns a single point. This blue tint in the limbs is a normal, transient physiological state, as the newborn's peripheral circulation slowly adapts to the outside environment. Finally, a score of 2 requires the infant to be completely pink from head to toe, proving excellent blood flow. Achieving full coloration secures the maximum 2 points for this row. Skin color is the fastest variable to check, but it is the least reliable indicator of overall cardiopulmonary health. That brings us to the P in our matrix, pulse rate. The heart rate is the single most critical determinant of immediate neonatal survival. Clinicians must perform direct physical auscultation, listening to the chest to get an exact count. If the heart rate is entirely absent, the score is 0, and the team must initiate total resuscitation protocols immediately. This is the most critical 0 on the board. For a functioning heart, the defining threshold is exactly 100 beats per minute. Newborn physiology requires a rapid, relentless pace to circulate oxygen. If a pulse is detectable but falls below that 100-beat threshold, the infant is bradycardic. A bradycardic state means the heart is beating abnormally slowly, signaling dangerous distress. A rate below 100 earns only 1 point. To score a 2, the heart must be pumping vigorously and functioning safely above 100 beats per minute. This healthy, rapid rhythm secures the full 2 points. In adult medicine, a resting heart rate of 90 is perfectly normal. In a neonate, 90 beats per minute is an alarm bell demanding immediate escalation.
The G in our matrix stands for grimace, which is clinically referred to as reflex irritability. Reflex irritability is the measure of how sharply the nervous system reacts to external, uncomfortable stimuli. Clinicians test this by clearing the airways with a suction catheter or gently flicking the soles of the newborn's feet. If the infant shows absolute flaccidity and 0 reaction to the irritation, the score is 0. A lack of reaction indicates deep central nervous system suppression. If the infant manages only a weak facial grimace or a very feeble, unsustained cry, they score a 1. This minimal response shows the pathways are functioning but heavily impaired. A score of 2 requires a prompt, aggressive reaction, such as a vigorous cry, coughing, sneezing, or actively pulling their limbs away from the stimulus. This active rejection secures the maximum points. Measuring this reflex accurately separates a healthy, reactive brain from one that is shutting down due to hypoxia. The final A evaluates activity, which is an assessment of neuromuscular function and resting muscle tone. A totally limp infant scores 0, slight flexion in the arms or legs scores 1, and active, spontaneous motion with tightly flexed limbs scores a 2. Healthy newborns naturally pull their limbs inward. Weak muscle tone is a direct symptom of physiological failure. The final letter, R, stands for respiration. The clinical trap here is that medical staff must evaluate the infant's breathing effort, not just the respiratory rate. A score of 0 is given if the infant is apneic. An apneic state means there is a complete cessation of breathing effort. No respiratory effort immediately zeroes out this row. A score of 1 means respirations are present, but they are slow, highly irregular, or restricted to gasping motions. Gasping does not pull enough oxygen into the lungs to sustain the transition. A score of 2 requires a robust, sustained cry, proving the lungs are fully expanding and clearing fluid. A loud cry is the best auditory proof of excellent pulmonary effort. With the 5 variables defined, the matrix yields a complete, quantifiable physiological snapshot, ready to be tallied. To execute the algorithm, the clinician calculates the sum of the rows horizontally, producing a final predictive index between 0 and 10. Looking at this completed scoring matrix, that final number dictates the immediate clinical response based on 3 specific zones. Scores from 7 to 10 fall into the green zone, indicating a normal transition. The infant only requires routine postpartum care, like drying and maintaining warmth. Most newborns land safely in this bracket. A score of 4 to 6 places the infant in the yellow zone, indicating moderate depression. This mandates immediate foundational interventions, specifically airway clearance and supplemental oxygen. Here, the medical team must actively assist the infant's pulmonary transition. A score of 0 to 3 is the red zone, indicating severe depression. This requires immediate, aggressive resuscitation to prevent permanent brain damage or death. In this bracket, survival depends entirely on external life support. By mapping specific scores to strict intervention protocols, the brackets remove all guesswork and hesitation from the delivery room. However, taking a single measurement is insufficient. The evaluation is performed at 1 minute after birth and again at 5 minutes. The 1-minute score acts as the initial alarm. It dictates whether immediate intervention is required the exact moment the umbilical cord is clamped. The 5-minute score serves a different purpose. It is a test of efficacy, measuring whether the interventions applied during minutes 2, 3, and 4 are actually working. If the 5-minute score remains below a 7, the algorithm locks the medical team into a repeating loop. They must rescore the infant every 5 minutes while intensive resuscitation continues. This sustained evaluation ensures that critical care does not stop until the infant stabilizes. The APGAR score is a continuously looping algorithm that brings order to the chaos of birth, ensuring every newborn's first minutes are protected by strict, objective data.